So this is the demonstration of the FUE donor scar. I'm gonna shave for the audience to see with the clipper without guard. Again, he already had a shave, and now we're gonna shave it a little bit shorter. You see, even then, it's very hard for you to see any scar at all. This completely shaved with a clipper without guard. Again, this one was shaved 1 day ago. Now, yeah, 1 day, right? Yeah. So this is shaving right now. Again, you see, the scar is there, but it's hard to see. Again, I do both FUE and FUT, but this is the demonstration of the FUE donor scar. FUE leave you tiny dots of scar scattered throughout back of mosaic pattern, allow you to wear your hair shorter. The strip method will leave you a linear scar from ear to ear and is permanent, and the strip method is more visible, and people are not very fond of the strip linear scar. But yeah, both methods have pro and con, and the pro of the FUE is not just minimal scar, less invasive, less bleeding, less chance of infection than the strip method. But the downside of the FUE are it costs more, and the number of grafts we can do is less. We can do 2,500 to 3,000. So it's very good for mild to moderate hair loss. However, you can do advanced hair loss too, if you just need multiple surgery. The other downside of the FUE is the growth rate of the FUE and FUT are good, comparable. I mean, FUT is around 90 to 98%, and FUE is around 80 to 90%. But my average is around 90. Again, the percentage is what, 5% less, not much of a difference, because you can have good density for both the result. The pro of the FUT or the strip method is cheaper. You can move more graft per day, 4,000 or 5,000 graft per day. It's good for a very advanced hair loss, and it grows 5% better than the FUE. But then both of them are good, FUE and FUT. The downside of FUT it's more expensive. No, the downside, it's not more expensive. That's the downside of FUT, because it has a linear scar. It's more invasive because we had to cut you open and suture you up. And the FUT is not just more invasive, more painful, more bleeding, more chance of infection. So this is the demonstration of the FUE donor scar. Thank you.